All right, good afternoon, everybody, and welcome to the Iowa Cancer Consortium's Capacity Building Series webinar entitled Radon Control Policy Lessons from Across the Country. My name is Allie Bain, and I'm an outreach specialist for the Iowa Cancer Consortium. The ICC is a nonprofit member organization that works to improve disease prevention, early detection, research, survivorship, and quality of life for Iowans affected by cancer. For more information about the ICC and its partners and programs, check out our website at www.canceroiowa.org. This website is one of a series of webinars meant to increase cancer knowledge among the ICC's members and partners. We hope that you enjoyed today's content and that you'll check out our organization's website for more information about archives and upcoming trainings as a part of this series. In response to November's Lung Cancer Awareness Month, January's upcoming Radon Action Month, and the upcoming legislative session, we wanted to offer an opportunity for Iowans to learn about radon policy that exists both nationally and on the state level. We are privileged to have radon policy experts here with us today, including Toby Bernstein from the Environmental Law Institute in Washington, D.C., and Bill Goebel from MB Radon in Urbandale, Iowa. Before we get started, let's talk through some of the webinar features. The webinar will be in listen-only mode using your computer. On the upper right side of your screen, you will see a chat box where you can interact with others on the call and ask questions to the presenters. Questions will be answered following both presentations. Please include the name of the presenter you are asking the question. If you have technical difficulties at any time during the webinar, please indicate so using the chat tool, and we will work to resolve your issue. The webinar today will be recorded and will be available at canceroiowa.org. While we gear up for our first presenter, let's take a moment to type in your name and the organization you are with in the chat box, and then respond to our first poll question. Please select all answers that apply. Question went away. Oh my gosh, didn't see that. If you are listening via phone, you can chat or silence your line by using *#. At the end, when it comes time for questions, you can unmute your line by using the same *#. All right. Our first presenter is Toby Bernstein. Toby is a senior attorney and the director of Indoor Environments and Green Buildings program at the Environmental Law Institute. Toby's work focuses on governmental programs and policies that address the health and environmental impacts of buildings. She has done extensive research and writing on state and local policy approaches to improving indoor air quality in schools, offices, and homes. She has also analyzed the role of government policies and programs in advancing green design and construction, particularly in the public school sector. Prior to joining ELI, Toby was an attorney at the Maryland Legal Aid Bureau, where she represented indigent families and children in housing, consumer, and other civil matters. Toby is a graduate of Harvard Law School and Washington University in St. Louis. All right. Toby, it is all yours. Toby, are you still on mute?
Allie, can you hear me?
Yes, now I can.
Okay, sorry about that if I muted myself. Thanks for the introduction, and thank you for organizing this. Hello on the webinar today. I'm going to give an overview of Iowa recently, radon in new home construction and radon in schools.
Toby, you're a little bit fuzzy on your phone.
Okay. Is this any better?
Yes.
Okay. I'll make the, tell me, please interrupt me if at any point it gets fuzzy again. I'm working on a headset, so that might be part of the problem. Just a little bit of background on the Environmental Law Institute. For those of you who don't know ELI, we're a nonprofit research and education center. We're located here in D.C., as Ali mentioned, and we were founded over 40 years ago. And we try to help develop effective policy solutions to a wide range of challenges. And we do this mainly through materials that we create, as well as the trainings and the educational events that we develop. We don't litigate cases in court. We don't lobby for legislation. We've had an indoor environments program now for over 25 years. Radon has been a part of that really throughout. And our radon work is much like the other work in our indoor environments program, focusing on state policies and programs and the role that they can play in reducing health risks. So why is state policy important? Starting point, I guess, for this really is the fact that over 20,000 lung cancer deaths are associated with indoor radon year, making radon the second leading cause of lung cancer. And the leading Bill Field, who many of you know at the University of Iowa, has called radon the leading environmental cause of death. So a very serious health problem. And in this area, risk communication is particularly challenging. Motivating individuals to take voluntary action to test for and mitigate high radon levels is very important, and it's been really at the heart of a lot of the efforts to address radon. But the communication in this area is difficult. The health risks are not immediate, and at this point in time, really accelerated progress is needed to reduce radon levels. There has been progress, of course, since radon became known in the U.S. as a serious problem in the mid to late 80s. Many homes have been tested and many have been mitigated, but the number of new homes built with high radon levels each year is outpacing these radon reduction actions. So state policy is one tool for trying to accelerate progress. Given the challenges with motivating voluntary action and the seriousness of the problem, I think it's important to look closely at how state policies are addressing the issue and how policies can help to shape the context in which individual decisions are made. Local policies can be important as well, but a policy at the state level really can affect many people and promote risk reduction throughout the state. So let's, before talking specifically about the policies that exist now, just a little bit of background in where we've sort of where we started and where we've gotten to. There is a federal radon law, the Federal Indoor Radon Abatement Act of 1988. This act authorizes EPA to do a number of things. This is the U.S. EPA. It authorizes EPA to conduct studies, demonstration projects, to establish guidance and model standards. It authorizes the SURGE grant program to states, and it also directs EPA to do things like develop the radon map and the action level, which is how we got the action level of 4.0 picocuries per liter. So it's led to a very active EPA program, but a voluntary one. The federal law does not establish a framework for federal regulatory action, so states really have broad flexibility to develop their own policies. And state legislatures did start doing that in the late 80s and early 90s. Currently, there are about 3/4 of the states that have a law that addresses radon in some way. Most of these deal with radon in the real estate transaction, requiring disclosure of information to prospective buyers. But there are other types of radon policy strategies as well. And there are new measures that are being considered and enacted every year. In recent years, there have been some notable developments in some areas, including the ones that I'm going to talk about now, new home construction and schools. So at this point, there are a number of states that have adopted laws and regulations that can provide models that other states with areas of high and moderate radon potential can build on. So let's move to radon in new home construction. Building codes are the most direct policy vehicle for addressing radon in new construction. As of now, there are 7 states that have building codes requiring radon-resistant new construction, which I'll abbreviate as RRNC. So these are the 7 states on the screen, and starting with New Jersey back in 1989, and Washington also had an early law which it changed more recently. And then over the past several years, a number of other states have started adopting requirements for radon-resistant new construction, the most recent being Illinois last year. Most of these states started with a law that the legislature enacted requiring the building code to include radon control requirements. Maryland did not have a law. Maryland included RNC in its state building code as part of its regular revision of the state building code. I also want to mention that there are a few jurisdictions, a few states that have adopted model RRNC codes and standards. Florida and Virginia are examples of states that have model radon control standards that local jurisdictions must use only if the localities choose to include RNC in their building codes. Maine is a little different. Maine's statewide building code includes a reference to an RRNC standard, and that's being interpreted as requiring builders to use that standard only if the builder chooses to incorporate radon control in their new homes. So, and then of course there are some local jurisdictions, including in Iowa, that have incorporated RNC into their own local building codes. I want to focus for a minute on the 7 states that have required radon control provisions in their statewide building codes. And this is just sort of an overview of the main elements of what's in these codes. Starting on the left with the standard that's included, as you can see, all of these 7 states include a passive radon control standard, the passive approach being one that relies on the convective flow of air upward in a vent pipe to exhaust the radon gas out and above the house. This is in contrast to an active system, which adds a fan to draw radon from the soil into the stack. The states all the way on the left, those 5 states, have incorporated passive RNC by adopting Appendix F of the International Residential Code. And Appendix F is a voluntary appendix. If a state adopts the IRC, it has to affirmatively also adopt Appendix F in order to include the radon control requirements or techniques. New Jersey has its own RRNC standard, but it's a similar type of standard to Appendix F. And Illinois is in the process of adopting its regulation, which should be something also similar in nature. I mentioned before that Maine is a state that has a voluntary RRNC standard, and that standard is the ASTM E1465 standard, which is a little different. That's a detailed RRNC guidance that includes pre-occupancy testing and activating the system if needed. Moving on to the middle column, geographic applicability. So there are 2 states, Illinois and Minnesota, that apply their RNC requirements throughout the state. And both of those states are mainly Zone 1 and Zone 2 high and moderate radon potential zone states. So in other words, on the EPA radon map, they have almost entirely Zone 1 and Zone 2 states. The remainder, the other 5 states, have applied their RRNC requirements to designated and specified high radon potential zones. Most of those states use the radon map that EPA has created, but a state like, they supplement that as well, and New Jersey has its own radon tiers that the requirements apply to. And then in terms of types of buildings covered, the states all the way on the right, the 3 states, Maryland, Michigan, Minnesota, those requirements apply to the types of residential structures that are covered by the IRC, which are single-family homes and townhomes that are 3 stories or less. And the 4 other states apply these requirements to all residential structures, or most residential structures in the state, and that may include multifamily or larger buildings. So RNC in building codes is fairly well established in a number of states, and even a state like Oregon, which actually has no Zone 1 counties on the EPA map, but its own mapping has showed that there are areas with high radon potential. So RRNC really could be considered the low-hanging fruit in terms of radon policies in states that have higher moderate radon potential areas and that already regulate many aspects of home construction. But there are some obstacles that have kept more states from incorporating radon-resistant new construction up till now. We'll talk about a few of those. The, I guess, primary one people think about being cost, and in this regard, it's important, I think, to note that including radon control in a new home is less expensive than mitigating high radon levels in an existing home. In terms of the actual costs, I think I'll defer to Bill on this. He may have some more specific comments, but my understanding is that the estimates can vary considerably depending on the type of home construction and the region. I heard a presentation by the Illinois Radon Program recently that quoted a cost of between $350 and $500 for a passive RNC system versus $800 to $1,200 for mitigating an existing work. Has also includes kind of comparable, maybe slightly higher costs for both categories. The new home purchase really is a key transaction opportunity. It's a major investment that's being made, and the cost of RNC can more easily be absorbed at that point. And of course, this is more difficult when the economy is constrained. The housing market is affected, but any discussion of the costs really have to emphasize the cost of inaction, which is the risk of lung cancer from indoor. Another issue is the standard to be applied. The passive radon control standard incorporated in F is a fairly easy step for jurisdictions that have adopted the IRC. But it is important to keep in mind that passive systems don't always achieve adequate radon reduction. 2 recent reviews found that passive systems can provide a 40 to 50% reduction in radon levels if the systems are properly installed. And of course, as with any home, without testing, you can't know for sure what the levels will be, even after a passive system or any system has been installed. I mentioned before that Maine had adopted the ASTM 1465 standard, which does include a pre-occupancy testing. There's also a new standard for RNC from the organization ARST, a new ANSI standard that as well incorporates testing and activation of the system if appropriate. And that is a new standard that's written as code language. I think in the coming years, we're more likely to see jurisdictions considering incorporating a testing pre-occupancy testing requirement. And I'll note that there is one large home builder, Richmond American Homes, which recently committed to including active systems in their new homes. And this is after some litigation that was initiated by purchasers of some of their homes in a subdivision where there had been alleged faulty or non-existent radon systems. So one positive outcome of that litigation is that now this large builder has committed to using active systems. In either case, disclosure is important so that the purchaser of the home knows what they're getting in terms of what type of radon system is installed and whether testing has been done. And as a side note, I'll mention that Iowa does have a disclosure law requiring that in a home purchase, including new home construction purchase, radon tests be disclosed if there have been any. There's also a required fact sheet to be included, and the fact sheet does encourage testing existing and new homes. So that's the fact sheet is an opportunity to maybe incorporate disclosure of radon systems or other information to the local officials that are implementing the code. So it's a strong policy will hopefully provide some resources to the state to assist local officials in understanding the requirements and how they can be best applied. But despite the implementation challenges, a state law really does have a great advantage because it can provide a minimum standard for RRNC across the state. A state's professional certification laws don't generally apply to new construction. So even if there's a law in the state that sets standards for how radon work is done by private sector professionals, those generally do not apply to people working on new construction. So without a building code, there isn't much oversight in terms of what techniques or systems are being used. So to sum up, the building codes, the challenges certainly exist, but many states have overcome them to put in place codes that can help prevent radon exposure and avoid what is really a thornier problem of how to get people to test and fix their existing homes. Before I go on to schools, I just want to also mention quickly two other types of policies that some states, including Iowa, have adopted that address radon in a smaller subset of new construction. One is state affordable housing finance policies. Most states implement programs that help finance affordable housing construction and rehabilitation. And these may be federally funded or state-funded programs. Often they include both single-family and multifamily housing. And what a lot of states have done is to incorporate into these programs requirements for addressing different health and environmental issues, including radon, so that the housing that these programs fund are healthy and green. And Iowa has done this with radon. So they have the Green Streets criteria. Many of you may have already know about these. They apply to a number of the Iowa Economic Development Authority programs. They require RRNC, the Appendix F requirements for new construction, and they require testing and mitigation, if necessary, for substantial rehabilitation projects. And then another area is green building policies. States may have green building policies or programs that either require or provide incentives for new construction to be green. And as part of this, they develop what the criteria are for being considered green building. So Iowa has in its building code a definition for sustainable design. And this would apply, for example, if an agency offers an incentive for green residential construction. And for residential projects, the definition does include an RRNC requirement. And it does this by referencing those Green Streets criteria and also the National Association of Home Builders ICC Green Building Standard. And both of those include radon. So I'm going to move on. I know we're maybe getting a little tight on time, so I'm going to move on to schools now and talk a little bit about some states that have laws addressing radon in schools. There are several states that are listed here. These laws vary pretty widely. Some are mandatory, some are voluntary, some address existing schools, and some focus on new construction. Here's a listing of some of the main elements of these policies. There are 11 states listed here. As you can see, 6 of them require radon testing. And the West Virginia law, I believe, only applies to schools that have been built since the law was enacted. Most of these incorporate some type of retesting requirement as well, maybe after 5 years or so. Most also require that the testing be conducted by licensed or otherwise certified qualified professionals. And as you can see, there are only 2 of those 6 states that explicitly require mitigation as well. And I'll mention that I saw a recent survey by the state of Colorado that showed that 40% of schools that reported finding high radon levels had taken mitigation action. Minnesota's radon program also presented results recently showed that not all of the schools that tested high had fixed the problem. So that is an issue in terms of whether it's important to include an explicit mitigation requirement in those policies. Most states that require testing do also require reporting to the state and also to the local community on the actions taken. And then you can see that there are 4 states that require radon-resistant new construction for new schools. And the other category refers to Illinois has a law passed within the last couple of years that encourages radon testing and mitigation. Minnesota has a law that provides that the state capital health and safety funding can be used for testing and mitigation, and that if it is used for radon, certain state standards have to be followed. The New York law is a little vague. It says that school districts are responsible for addressing radon, but doesn't go into any detail about that. Also want to mention a footnote here that there are a number of states that address radon in child care facilities, and Iowa is one of them. Iowa requires testing and also mitigation if elevated levels are found. And of course, there are challenges in this area as well, starting with the difficulty of establishing new state requirements for local school districts. But again here, you start with the significance of the health risk and the role that the state can play in promoting a consistent approach in schools throughout the state. So for example, it may be important to include an explicit mitigation requirement in a radon in schools law so that you don't end up with only some school districts mitigating elevated levels and you can achieve risk reduction throughout the state. Cost is also an issue, and there really is no easy answer here. Their funds for facilities, school facilities are limited, and they always have been, and they are now. As I mentioned before, Minnesota does allow testing and mitigation as an allowable cost in their existing health and safety funding programs. If there are other existing programs in the state that provide funding for repairs or capital projects, radon could be added as an allowable expense there. Also, Illinois has established a program in partnership with the American Lung Association to provide equipment and technical assistance for school testing in that state, and I believe other states have similar programs to try to help school districts do radon testing. And guidance I mentioned because guidance that provides appropriate testing procedures can help ensure that there's no unnecessary cost for redoing work that was done improperly, or can maybe help avoid unwarranted mitigation actions because of inaccurate measurements. And then last, technical standards. EPA does have older guidance on testing and mitigation in schools, but there have been recent efforts as well. There's a new Minnesota guidance on radon measurements in schools, and ARST is in the process of drafting standards for school testing and mitigation as well. So schools, radon in schools is definitely starting to get more attention, and we may see new policies in the coming year. I will wrap up there and just note our website. If you would like to get some of our materials, we did a report, Radon in Homes, about a year ago. Goes into a fair amount of detail on state laws, not just in new construction, but other aspects as well, such as certification and real estate. And then there are a bunch of other materials that include different compilations of radon policy at eli.org/buildings. And I'll be happy to take any questions at the end of the show. And please feel free after today's webinar to get in touch with me if you have more specific questions that I can answer.
All right, thank you very much, Toby. Let's get geared up for our second presenter here. Bill Goebel is the owner of MB Radon in Urbandale, Iowa. Bill has been a radon mitigator and tester for 10 years in the central Iowa area. He assists with IDPH mitigation classes yearly by having classes come to a customer location to assist with the mitigation project. Bill helped start the Heartland chapter of ARST, which is the American Association of Radon Scientists and Technologists, covering the states of Iowa, Nebraska, Kansas, and Missouri. He served as president for 2 years and is currently a member. He has also served on the National ARST Board. Bill has been involved with outreach to lawmakers for several years to gain support for radon bills in Iowa. All right. Thank you very much, Bill, for helping us out today, and the floor is yours.
Okay, good morning, everybody. I think Toby probably hit a lot of the high points that I was maybe going to hit also, but it doesn't hurt to repeat a few of those things. I guess as far as our radon-resistant new construction, with the high number of homes being built, it's kind of a losing battle right now for comparing the number of homes built versus the number being mitigated. In the state of Iowa, the percentage is pretty close to 70% of homes in Iowa have too much radon, so we definitely have a problem here. As far as interest on the part of builders, they seem to not have a lot of real interest in radon unless the customer brings it to their attention. And there are a few people who are putting in passive systems at this time. I guess more of an issue for builders is moisture and dampness control, which can also be helped by the installation of the radon systems. The passive systems may be run at a 50% reliability rate as far as reducing the radon. So it would be very important to do retesting even if you do have a passive system in, because there really isn't any way to know how well your system is working unless you do a test after it's installed. As far as the real estate market, the realtors have been somewhat receptive to having testing done at the time of sale, but they're probably not happy about it since it's a little bit more work for them to sell a house. Nothing's required yet, but it would be nice if something were done at the time of sale, similar to termite inspections, appraisals, and septic system tests. It would be nice if they could just have a radon test done at the same time and just kind of have that done up front so everybody knows what's going on at the time of sale. Going to schools, I know there's been a little bit of testing done that I have seen and worked with a few schools on some systems and planning. Since they're such large buildings, they tend to be a little more complex and have more issues regarding the heating and ventilation controls on the building. That's more critical on a large building to consider the whole building versus maybe just the underfloor area as far as mitigation goes. And with the new guidelines being put together by ARST for testing and mitigation strategies, that should help a little bit to give people a little bit more guidance on which way to go with their testing and mitigations. I guess another issue we've been dealing with is rental housing. Again, you can run into some very large buildings, and the landlords are probably going to need a little bit of a push to do very much on their own unless they're pushed by their customers and tenants, et cetera, to do testing in the buildings. Different. Everybody's state is different. Right now, I guess Iowa doesn't have a lot of laws on the books about testing in general. It would be nice if people could contact their legislators and say, hey, we're concerned about radon in our district, and there have been laws proposed here the last couple of years that didn't get very far. I guess last year the radon bill made it through the Senate but failed in the House. So hopefully we'll take another run at it this year. There are also some things available for contacting the legislators or breakfast and the ACS. There's an ACS breakfast and awareness days, things like that going on. I guess the more people who get involved with that, the better, and or contact your legislators in advance and let them know that those things are going on and you support radon legislation, and just get in touch with people and let them know that you are involved and interested in seeing things like that going on. Just one more item we've tried to get in a bill is every radon professional in the state pays fees to the state. There are licensing fees for mitigators and testers, and mitigators pay a $40 fee per system to the state for their service as part of their renewal for their licenses. And currently that money is going into the general fund and does not go into the radon program as such for education or other purposes there. So that would be another item that would be nice to add on to the state radon bill for consideration coming up in the future. So I guess that covers most of the things I was wanting to hit. We'll go to questions or whatever your format is there, Allie.
Yes.
Go from there.
Now we will open it up for questions. So if you have any questions, please type them in the chat box. And if you could please include which presenter you are directing the question at, that would be great. While people are typing in their questions, I just wanted to let you know that we will be sending you an evaluation to fill out. This helps us plan for future events and let us know what you thought of this webinar. Also, please be sure to visit canceriowa.org for additional information regarding past and future webinars as a part of the Capacity Building series. And if you are joining us via phone and would like to ask your question over the phone, you can unmute yourself by using *#. So we did have one question earlier about in states where testing is required for schools, do they disclose the results to the parents? Toby, can you elaborate a little more on how they share the results in those states that do mandate testing?
Well, I know that the states generally require that radon test results be either made available or affirmatively disclosed. I can't right now tell you the specifics of each state and how that works, but I would be very happy to get that information to whomever wants it. It is basically, there could be an sort of affirmative requirement that the information be presented, or there can be a passive requirement that it be made available. I just can't right now tell you which states require what. Of course, it's my view is it's better that the requirement be an affirmative one, that the information either be made available on at a public meeting, at a school board meeting, or in some other way as opposed to simply being available. But like I said, I can provide the details on that, and anyone can reach me at my email address, which is my last name, Bernstein @eli
All right, great. So our next question is probably Bill can take the best stab at it. Is anyone aware of attempts to require testing on residential real estate transactions?
That was part of the radon bill that's been submitted at least last year for sure. It's kind of an ongoing part of the radon bill that we've been trying to get through for the last couple of years, so that is ongoing.
And then as a follow-up, Gloria has asked, what is the new Iowa legislation request going to look like?
I believe that's got a lot of the topics we've been talking about here for residential testing, radon-resistant new construction. I believe there's a section in there for landlords and rentals. And there might have been something in there about schools also. I would have to look through the list and see exactly what they have in there right now.
Allie, I can just maybe mention one quick thing on the requirement for radon testing. I don't know of any states that require radon testing as part of the real estate transaction, but in the report that I put up on the last slide, we do note that there are some states that require other kinds of environmental testing in the real estate transaction, and this could be some way to analogize to radon. So there are at least a couple of states and a number of local jurisdictions that require testing of private drinking water wells. And there are also a couple of states that require testing of private septic systems, including Iowa. So that's one thing to keep in mind. And then there's one state that requires landlords to test for radon, and that's the state of Maine.
All right. Bill, what is the average amount of time or cost for a community member to become radon certified in Iowa?
It depends on the person there. What's required is a training class, which is sponsored by the state of Iowa, that is usually presented by the Midwest University's Radon Consortium. There's usually a 3 or 4 day class for radon testing, and then people would have to take a nationally administered test and pass that, and also submit their operating procedures to the state and have that reviewed by the state to be granted a license to do radon testing. And as far as mitigation, there's a pretty close to a week-long class, again, presented by the state and the Midwest University Radon Consortium. That, again, you'd have to take the class and pass the test, and then also submit your operational procedures to the state and to be reviewed and approved by the state to provide a license. Could be several weeks of time involved presenting everything to the state and getting all of your operating procedures down that need to be in place to be licensed to do the work in Iowa.
All right. For states that require testing in schools, are the schools able to do the testing on their own, or do they have to hire professionals?
The states that have radon certification laws would require the testing be done by someone who's certified. There are a couple of states that have radon testing in schools requirements but don't have radon certification laws, but they do have some provision in their law. So for example, Colorado and Virginia have school testing requirements, and they don't have certification programs, and they require that the testing be consistent with EPA guidance. And Connecticut, which Connecticut also has a school testing law and requires that the testers be qualified, that they've taken the National Radon Safety Board, course and a state exam. And also one interesting thing is in Illinois, which has a law that is not mandatory, they just encourage radon testing, there is a provision that the state can exempt schools from the certification requirement if but it's sort of, the school personnel have to, I think, take a state course or take some state training in order to do the testing, but there is some flexibility there.
Okay. The next question is any attempt going to be made for separating the legislative issues rather than having it all in one bill? Bill, do you have an answer for that? I would say
Go
for
ahead.
any questions that are dealing with policy that will be introduced in the next session, we will defer you to the American Cancer Society Cancer Action Network, and the contact there is Cassie Furlong, whose email is on the slide here, and she's also on the call, so she will be able to answer any of those questions that you have about current legislation that's being introduced or the bill that has passed in the Senate but has not passed in the House. So the next question is anyone aware of radon regulation efforts at the local level, like local boards of health? Since passing legislation at the state level is so tough, this strikes me as a way to make some progress, even if incremental.
Yeah, there are some local jurisdictions who do require radon-resistant new construction. So there have been some inroads. I believe Iowa City requires radon-resistant new construction on residential structures. So that's something that can be passed by individual jurisdictions of the building officials or whatever is there in that particular area. Sometimes it's counties, sometimes it's individual cities who maybe choose to adopt the Appendix F of the building code and enforce it in their local jurisdictions. So that is something that has happened in a few areas.
Another possibility for local level action is in housing codes dealing with rental housing. I only know of one. We don't track these because it's really hard to track local legislation, local codes, county by county or city by city. But I do know of Ann Arbor, Michigan is a place that does have some radon testing requirement in its housing code that applies to rental housing, and there may be others. So that's certainly one thing, because often these housing codes that deal with rental housing are adopted at the local level.
Okay, Bill, would it be better to focus on one item such as RRNC for the new legislative proposal?
And there may be some benefit putting that up. Again, that might be something the American Cancer Society would have a better handle on as far as policy proposals.
All right, and has it been confirmed that lung cancer cases in Iowa correspond to the areas of highest radon levels?
That might be
That's
a good
something
question for Dr. Field.
Yeah, that's what I was going to say.
So, Jackie, if I can email you, Dr. Bill Field at the University of Iowa is one of the nation's leading radon experts, and I'm sure he would be happy to have that conversation with you. And if anybody else is interested in contacting Dr. Field for some of that more specific information, we can certainly get you connected with him. All right, do we have any other questions? Do we have any questions from anybody that's on the phone? All right, well, thank you very much. to today's presenters for sharing this wonderful information, and thank you to everyone who has joined us. We hope that you find the information valuable, and please let us know if you need any additional resources. Please remember to fill out the evaluations that should have been sent to you, and as we had said previously, this webinar will be available on canceriowa.org if you would like to view it again or send the link to any of your colleagues who may be interested. So thank you very much, everyone, and we hope you have a great afternoon.
Thank you.